Dr. Darien, so this is your world we're about to talk about, the ER, and how do we make kids feel less anxious in
Less
the ER?
anxious, less scared. This is a study that I think my medical team is going to hope I bring to life. It's a study that shows that a few minutes of cuddling with a therapy dog can reduce that anxiety and that fear among children. And it was a significant drop. This is a new study published by JAMA, a large peer-reviewed journal, and they examined 80 children who were going through that scary emergency room visit, and they found that those children who had a therapy dog experience during their hospital course had almost a double point reduction in their anxiety and their fear compared to children who did not have that access.
So how do we make the ER less scary for kids and big kids who are 46 years old?
Yeah, it's very, honestly, the second part of that is very important. The second part of that is very important, but I think it's so important to help providers and everyone understand why it's so necessary to make the emergency room and all clinical experiences less scary. I still have memories from being a child in the examining room. I remind my medical students and my residents, if they still have those memories, our goal is to not make new ones. So you can do a couple of things. If you don't have a dog, you can follow some basic guidelines by talking to the child, giving them instruction, information is always less anxiety or helps to reduce anxiety. Also leading with their choices. An example, instead of saying, I'm going to check your blood pressure, ask which arm would you like to get the blood pressure taken. Eva's daughter has some great concepts and skills that she uses to get herself through the emergency room. I think that what you taught me was really helpful.
Oh.
Yeah, the doctor shows her on the rubber chicken what's going to happen.
Yeah.
And like when she gets the shot, he squeezes it and goes, oh!
And you can use that with Eva's daughter or 46-year-old patients. Regardless, it's about helping to inform about what's going to happen using a calming voice and focusing on one voice instead of many voices. That's, I think, especially important.
Please pass the rubber chicken on to me.
Yeah, Doc G, we love you.